And welcome into Community Action, a program designed by Maine's community action agencies to help the state get through the remainder of the COVID-19 pandemic, also to talk about vaccines and the importance of getting vaccinated and where you can get vaccinated locally in your community, and all of the social supports and other services that are available to Mainers during these most difficult times. On this week's very first program, we're going to talk to Dr. Nirav Shah and then 3 leaders who are working across the state of Maine to get the information about vaccine supports out to the community. We're going to speak with them in just a moment, but before we do that, we want to first share with you information where you might be able to access your local vaccine. That's very important, and we want to get that out right at the top of this broadcast. And so we share with you that the best resource if you're looking for your local vaccine is to first look through the state of Maine at maine.gov/COVID-19/vaccine. And it is important to note that we are now, as of April 7th, having all Maine residents aged 16 and older eligible to receive their COVID-19 vaccine. So this resource is available to most Mainers at this time. All sites at this time are requiring an appointment, although we're going to speak with our guests about some other opportunities moving forward in the state that may be allowing you to just show up. At this point, we also want to remind you about the COVID vaccination line. That's 1-888-445-4111. It's open Monday through Friday, 7 a.m. to 7 p.m. and on Saturday and Sunday, I should say, from 8 a.m. to 2 p.m. This is where you can get all of the information on where you can get vaccinated and information about the vaccine itself. You can also go to maine.gov/COVID-19/vaccine, again, to find a place in your local area where you can get vaccinated. And we are pleased to be joined by our very first guest on Community Action, Dr. Nirav Shah, the State CDC Director. Welcome to Community Action.
Hey, great to be with you, Jason.
So we're talking in this program about the importance of getting vaccinated, and certainly you have been talking about that far and wide through Zoomland and other avenues. Why is it important for the state of Maine and for individuals to get vaccinated?
Well, there's a lot of reasons right now, Jason. The first is we are seeing an increase in the number of cases of COVID-19 that we've got across the state. Just last week, we started seeing an increase to levels that we haven't seen since January, December of last year. That in and of itself is concerning. But the other reason why getting a vaccine is really important is not just that it keeps you safe. The real beauty of vaccines is that they keep other people around you safe as well. You get to not only protect yourself, but you get to protect others in your community who haven't yet been vaccinated or can't be vaccinated because maybe they have a medical condition that prevents them. When we all get vaccinated, we create this bubble around our communities that keeps everybody safe. Now, COVID is not to be trifled with. It's serious. It causes permanent lung damage in some people. It can affect your heart. It has real long-lasting consequences. The fact that you can go somewhere and spend a couple of minutes and get a shot or two that keeps you free from those things is a pretty major advance. And I encourage everyone to take it up.
And that, at the end of the day, really is the COVID vaccine that's being administered, the variations of the COVID vaccine that are being administered. They are all intended to prevent those most drastic effects of COVID, correct? It may not be 100% effective of not actually getting COVID, but it's really about sustaining life.
You nailed it, Jason. I mean, the reason we vaccinate people, the reason we created vaccines in the first place, is to keep people alive, right? That's the bottom line, to keep people alive, to keep them out of the hospital, to keep them off a ventilator. And all 3 of the vaccines that we have right now in the United States are spectacularly effective at keeping people alive and keeping them off a ventilator. Upward nearly 98, 99, or 100% effective. Imagine that. Something that, again, takes you 15 to 20 minutes to get, that can reduce your chances of being on a ventilator by 100% if you got exposed to COVID. It's one of those things that kind of makes you say, what an amazing time to be alive, even though we're in the midst of a pandemic, which is awful and wrenching. To only be 1 year in and to have something that reduces your risk by 100% of needing to be on a ventilator, it's a scientific miracle.
So the efficacy is certainly there. The information is and the evidence on the efficacy is there. Dr. Shah, talk about the science and folks who are concerned about the what the side effects may be of the vaccine itself, or that are fearful about getting the vaccine for a whole host of reasons.
Well, let's talk about folks who are reluctant, hesitant, or scared to get the vaccine. I get it. I mean, that's the most important thing. I understand why folks are reasonably concerned about the vaccine. Mentioned a moment ago, a year ago into this pandemic, we didn't know left from right, up from down. And here we are a year later, and we have 3 vaccines that are stunningly effective. It seems like it's almost too quick and too good to be true, right? We hear all the time that vaccines take decades to develop. And here we are in 1 year having developed 3 of them. What's up with that? Are they safe? Did any corners get cut? And the answer there, Jason, is that the speed with which the vaccines were developed was not because corners were cut. It was because the best scientists in America, across the world, came together and figured out how to make this happen because it was our #1 goal. The only thing that was cut was red tape, not any safety corners. Now, I know folks have concerns about side effects too. Thankfully, across the hundreds of thousands of shots that have been administered in Maine and the millions of shots that have been administered across the globe, the side effects have been minimal. Folks report maybe having a little bit of pain in their arm. Maybe after you get your second shot, you might feel crummy for 8 or 10 hours, but those have been the extent of the side effects. The vaccines are both safe and remarkably effective.
So before we move on to our next guest, I'll let you have the last word in terms of speaking directly to the people of Maine, the people who are watching Community Action, and telling them why it's important.
Here's why I think it's really important for everybody to get the COVID shot. We all want to be back on that road toward normalcy. We're all craving that life that we used to have back before COVID in 2019 and before then. And the fact is, getting there and the speed with which we get there, it's up to us. It's in our hands. The fastest, most efficient way to get back to the lives, that normalcy we're all looking for, is to get vaccinated. COVID is serious, and the vaccines are safe and effective. And most importantly, they position us on that path toward normalcy. That's what we all want, and the vaccine is what gets us there. That's why I encourage everybody to take some time to get your shot.
Thank you, Dr. Nirav Shah. We're going to be joined by some other guests in just a moment who are going to certainly echo that and speak further about why it's important to get vaccinated in the state of Maine. But certainly, as the leading expert and recognized expert in our state, we're most grateful that you took a few minutes out of your busy schedule to join us on Community Action. Thank you so much.
Thank you, Jason.
And again, our thanks to Dr. Shah for joining us on Community Action. We'll be joined by some other guests in just a moment, but we want to tell you about the Maine COVID-19 vaccination connection line here. If you are able to get information about getting COVID vaccination in the state of Maine, we want to remind you again that as of April 7th, all Maine residents 16 and older are eligible for the COVID-19 vaccination. So in most cases, this information in terms of locations of vaccine availability would apply to all above the age of 16. We just want to share that the COVID vaccination line that has been set up by the state of Maine is available. That number is 1-888-445-4111. It's open Monday through Friday from 7 to 7 or Saturday and Sunday from 8 to 2. It's available also online at maine.gov/COVID-19/vaccine if you're looking for facilities nearby you where you can get a COVID-19 vaccine. And to discuss this and much more, I'm very pleased to be joined now by our next guest, 3 individuals who are looking at this obviously from a statewide perspective. They are in the corner box, I should say. We're all in corner boxes because there are 4 of us. Sharon Mcdonald, who is the Director of Social Supports for Isolation and Vaccine Equity for COVID-19 for the Department of Health and Human Services. And I twisted that a little bit, but we get the gist of it. So thank you, Sharon. And also from the state of Maine, from the Director of Community Vaccine or Vaccine Communication, I should say, for Maine CDC, Lindsay Hemis. Thank you so much for joining us. And my colleague, Megan Hannon, who is the Executive Director of Maine Community Action Partnership, MECAP. Megan, welcome, and thank you for joining me. It's great to have you on.
Good to be here, thanks.
So we're going to talk about sort of a continuation of the conversation that we just started with Dr. Shah about vaccination in Maine. We're going to expand that to talk a little bit more. But Sharon, first of all, I want to catch up with you because we are certainly not at the end of COVID-19, even though we're able to expand vaccination to such a large percentage of the population and more Mainers are getting vaccinated. One of the services you've been offering looks at individuals who are impacted by COVID-19 or who maybe have COVID-19. So talk about the social supports.
Sure, and thanks so much. Anybody that is diagnosed with COVID, has a positive test, or is a close contact is eligible for community care or social support. There's a very easy online form that they can fill out, or their doctor, social service agency, anything. And what we do is make sure that you can stay home safely and relatively comfortably for the 10 days that are involved. And so, for example, there might be food that needs to be brought, pick up your medicines, we've done anything from firewood, making sure that masks or pulse oximetry is available. We also make sure that people, if they need, might get help with their unemployment forms, rent relief, transportation for testing, various things. We just try to really wrap around and make sure that you're okay there. The CDC contact tracers and case investigators help by making sure that when they call you, they also offer this. But sometimes you get off that call, you might just need more information. Our folks are also available to do that. At this point, we have helped serve 7,000 Mainers across the state through 3,000 households. So we look at it as a household issue. And so if you've got somebody in your household or many people affected, we are happy to have local agencies come in and help.
We Mainers can be quite independent by nature, and this is not a program that you want to discourage anybody from taking. It's not an income eligibility requirement. There are no real requirements other than if you feel that you need these services and you are trying to quarantine or isolate, correct?
Yes, and it's all free. And in fact, sometimes, I like to think of the fact that when somebody gets a call saying you have COVID or somebody in your household does, it's a shock. And so it may be that simply making a referral to say, can you call me a second time and just make sure I have more information, can ask more questions, that just sort of offer that. So we do that because sometimes the case investigation process, they're moving fairly quickly and we can follow up, particularly in other languages if that's helpful, and just to get more information. We also have the chaplain service, which sometimes it's just nice to have somebody call and ask if you're okay.
And I know that you're working with community action agencies and with other community-based organizations across the state. So the call is placed. The Department of Health and Human Services works on sort of doing the initial, how do we get the services out to folks, and then you work with local partners. So you're not really putting anybody out to provide these services, and it's coming to you from a local source that knows your local community, knows the resources.
Exactly. In fact, when I say we, I'm talking about the community action programs across the state, Wabanaki Public Health, Catholic Charities, and about 40 local community organizations that speak many languages and have really been there from the beginning, providing support to their communities in many languages and in many rural areas.
So that's a perfect bridge to the other part of your lengthy title that we were talking about earlier, and that's about vaccine equity. We're going to talk about vaccine communication with Lindsay and Megan in just a little bit, but want to get the perspective of the process of making sure that there's equitable and fair distribution of the vaccine, as there has been with the social services that have been able to be provided, and making those connections and those linkages happen. What are some of the challenges and the opportunities that we have in the state of Maine with where it relates to vaccine equity?
Well, one of the opportunities has come from federal funding and other funds available to support equity of distribution. COVID really revealed a lot of inequities based on people of color, people that are in deeply rural areas. And so to some extent, opportunities have been put forward to really say, we need to address those inequities and find ways to work with them. So lots of partners are coming together to make sure that there's all sorts of approaches to address this, whether we're looking at new kinds of community health in rural areas, mobile teams, making sure that languages are available, that sort of thing. So that, the easy 50% of people are probably being addressed. We're now going to move into the harder folks, people that are more either unwilling, just don't want to drive too far, are not certain, that kind of thing. And I think that those final 50% and then 10%, we really do want to make sure that we make an effort to reach out to them so that we can all be safe.
So it really does look across the spectrum. You mentioned, geographic isolation, living in a rural community, that there are equity issues around that, as well as there are issues around culture and race and the like. So it's really looking very broadly from an equity lens at this perspective.
Exactly.
Now that sort of transitions to part of the opportunities and challenges that lie with communicating about the vaccine. Obviously, Lindsay Hammes, thank you so much again for being with us. Talk about your role and about the work of getting the word out about the importance of vaccination, not only getting vaccinated, but where you can get vaccinated.
Yeah, no, exactly. So thank you so much for having us on, Jason. This is really great to be able to chat with you. As you say, it's a challenge, first of all, just to get folks kind of up to speed and aware of how things are moving, because they are moving at a really quick pace, and we understand that, which is on the one hand great news, right? Because we I think initially thought that this whole vaccination process was going to roll out quite a bit slower than it actually has. That's good news, because it means we're getting shots into arms here in Maine, and there's lots of opportunity. We're getting more vaccine from the federal government faster than we initially thought. But it also means that eligibility brackets have shifted faster than was expected, and that people may not know, is it my turn, right? And so sort of the initial communication that's been really important to get out, and that we've been working with our community action partners, our other community-based organizations, the Maine Immigrant Rights Council, the Catholic Charities, the 40 organizations that Sharon mentioned, is to share the information about who's eligible when, and then how can they go find those places to get vaccinated. So of course, there have been the twice weekly briefings that Director Shah, the Maine CDC, has been doing, often in partnership and collaboration with DHS Commissioner Jean Lambrou, and sometimes also the Governor Janet Mills has been joining. But those are sort of mainstay places for communication, but things move along in the interim as well, and people don't always get to tune into those. So we're working with our community partners to make sure that we're reaching folks where they are, whether that's on social media, whether that is, when the community partners are going door to door, providing the social support services that Sharon's talking about, and trying to tell folks, okay, now you're eligible, and here's how you can find an appointment. And whether that's calling the community vaccination line, and I can give that number here if that's helpful. I know you've got it as well, but that number is, just again, 1-888-445-4111. And that is a great place for folks to go who have a hard time getting internet access, who are having a hard time navigating the website for whatever reason it may be. And they can call and help get an appointment. Now, it isn't a place to get it's not a faster accelerated lane to get an appointment. And we understand with the changes and fluctuations and when we get vaccine here into Maine, sometimes it's going to be easier to get appointments than others week to week, and that sort of will ebb and flow. But the people at that line can help you find the place that hopefully is easiest for you to get one and quickest. And then I think the communication beyond that is also, how can we help you get to the appointments, right? So Maine DHHS has stood up a transportation service as well that provides free rides. Again, no income requirements needed there. And that is, you just need to call 48 hours in advance and arrange for your appointment. Arrange for your appointment to get a ride to your vaccination appointment. And they will drop you off and then come back. I believe it's 60 or 90 minutes later, depending on, I think, their schedule. And that is a free ride to and from the appointment. They can take, I think, you, and if there are any other members of your household that need to go as well. So that line, I'll just give it to you too, is 1-855-608-5172. And again, that's a free service for all Mainers.
So Lindsay, one of the aspects of the communication that we haven't talked about, and I know that some of this goes over to Megan, and we'll chat with her about that in a moment, is the importance of getting the vaccine. You're providing the information about how to get to the vaccine, how to get your appointment schedule, but we're working as well across the state in terms of, we talked about this with Dr. Shah, of why it's important that we get the vaccine and encouraging folks to do their part. Correct?
Yeah, absolutely. I mean, sort of the idea is that we can do this, but we need everybody to do their part to do it, right? And so we need to reach that sort of herd immunity level so that we can get back to the normal life that we're looking forward to getting back to I heard you talking with Dr. Shah earlier about various festivals across Maine that, that people are anxious to get back to. And in some cases, those might be canceled this year or postponed, but in certain cases, we still have opportunities for those sort of community events, and even just sort of your backyard barbecue kind of a thing. But to do that safely, we need every Mainer to get vaccinated, every Mainer who's eligible to get vaccinated. And so we just need everybody to do their part. And it is safe, it is effective, and it's just a really good thing to do for your health and for that of your family and your community.
And Megan Hannon, Lindsay was mentioning the word community there a number of times, and that's really where community action kicks in, appropriately so. What's the network of community action agencies across the state doing to engage in this effort?
Thanks, Jason. Well, we are meeting with each other and with the 40 organizations that have been mentioned a couple of times now. We meet with them every Wednesday. We have a small steering committee that meets every Thursday and every Monday. We have messages that go out to our 10 CAP agencies, but also to several of our partners so that we are all saying the same sort of thing. We're looking at fun things to do. I mean, this is not a fun thing usually to think about, but now we're at the point where we can say, hey, I got my shot. You can put it in your own social media. People like to hear what their peers are doing. We know that there are some people who are a little hesitant or afraid about the vaccine, but when they start seeing that other people that they care about are doing it, then that makes them more likely to do it. So we're working really to show that, as Lindsay just said, there is a light at the end of the tunnel, but we have to do this in order to get to the end of the tunnel. I mean, I know people are impatient, and we've all been, stuck at home for a long time, but we need to stay stuck at home for just a few more weeks, maybe a month, depending on how things go, so that we can all be out together sooner than later.
And this is the pathway to getting unstuck, isn't it, Megan?
Absolutely.
So we do have 10 community action agencies across the state. The connections that we already have in our communities, Megan, that's proving to be critical in this effort. And I think part of the reason why we're partnering with the state in this initiative is because we're reaching a lot of people in our communities on a daily basis, and that's a critically important thing in many ways. So Sharon talked about social supports. I think it all comes really full circle in this conversation, and that's in the way that you connect with people. We're talking about opportunities to connect with individuals who are connecting with us now for rental assistance or for what have you, and really looking at this from a systemic level.
Absolutely. And, when the age changed in a pretty quick way, we had been thinking about, well, when the time comes, we can start talking to our Head Start parents. Well, the time came. And so we were able to create some things to make sure that every family had something that went home with them that said, by the way, I know you're busy. You probably aren't watching the news every night. This has changed. You're now eligible. And so, make an appointment. And it's not time for the little kids yet, but that's okay at this point. If we get the adults vaccinated, we're going to be in a much better place when that time comes. So getting it out through that, we're still delivering meals. So making sure that those go in with our meal deliveries, flyers, social media. We're doing some things that are going to be on more traditional media as well. So really trying to blanket the state with the message that vaccines are safe, they are effective, and we all need to get one.
So Sharon, how are we doing as a state right now? How are we doing with both our work? We talked with Dr. Shah a little bit about this, but with our work, your work around supporting individuals who are struggling through COVID, struggling with COVID, and in our efforts to get folks vaccinated?
Well, certainly from the social support points of view, we take a coalition, a motley, wily group of social workers and public health people, and just make sure that person can get tested in their home, that they can get firewood, that they can get a chaplain call. Last night, I was so moved by something that came out of KVCAP, where they had found a family, made sure that that person had neighbor support, chaplain support, food, that sort of thing. And they're very excited about doing that. I mean, there's something very satisfying in this kind of sense to not feel helpless and feel like you can help and do something for your neighbors. So there's been a lot of participation, and we have lots of ability to provide more, so people shouldn't feel shy. Regrettably, the number of cases are going up right now with the increased variants that perhaps are more transmissible, and as people move around more. So the good news is we have capacity and we have a lot of partners. The bad news is we have a lot of virus in. We have probably cases going up almost like we did last November, but there's an enormous amount of vaccination happening. And we're not seeing huge inequities in terms of based on race, it's mostly based on age, but that's how we set this vaccinated first. And we've been able to rip through and really get, change those tiers. So the other thing I think now is to really make sure that the younger folks are getting vaccinated. The average age of cases with COVID right now is 34. So we need to be sure that those folks are getting vaccinated and that they are given the incentive and support to hang on and wear masks and get tested if there's any question.
And Lindsay, it's data like that that people really need to know and understand so that they can make the right decision as it relates to this, correct?
Yeah, absolutely. I was just going to jump in and say, I think that's a really good point. We're seeing cases rise again, which can be scary, right? But I think the good news, if we can put a good news point on it, is that that average age is dropping, and the cases of hospitalizations aren't spiking. The cases of deaths aren't spiking. And so what that tells us is that the vaccines work, right? So for that community that hasn't yet had the opportunity, but is now eligible to get vaccinated, should go get vaccinated, because it does a really, really great job at keeping folks out of the hospital, keeping them off of ventilators and keeping them alive. So that's the important message there. These numbers can be scary if you just sort of hear them out of context on the evening news or in the headlines. But the vaccines work. And so we need to get to that population that is now eligible, but hasn't been up until this point.
Great. Megan Hannon, last words from you on the effort to get Mainers vaccinated, to get Mainers safe, and to get Mainers back to business.
Business. Well, just to also, finish up what Lindsay was just talking about. It does sound scary when you're saying, 400 new cases, but we're still have some of the lowest positivity rate in the country, and we still have some of the fewest deaths in the country. So we are doing well, and we just need to really keep on that path so that we are at some point getting 1 or 2 new cases and then none eventually. So, as stay masked, stay distant, keep washing your hands. The other good news, as you guys have probably heard, no flu. People aren't in the hospital for the flu. So we should continue washing our hands for the rest of our lives. And, that might be a silver lining out of this, that we learn that washing hands is a simple thing that really does matter.
So lastly, the entire purpose of this particular recording in this broadcast is to really encourage Mainers out there to hopefully turn and get one of these from having gotten one of these, right? So let's get your perspective, because Lindsay, as you know, as a communication person, I'm a recovering communication person, probably not fully recovering considering I'm doing this with you, but talk about why you think it's important, why you would recommend for somebody to get the vaccine.
I think it's pretty simple, at least for me, right? I want to get back to the point where we may not have to all be wearing masks all the time. I want to hug my best friend's little kids. I want to hug my friends in other states. I want to feel safe that my mom, I don't have to worry about, people coming in and out of the house and potentially infecting her, right? And once we all get vaccinated, those transmission numbers are going to go down. And that means that we can be with the people we love in the way that we want to be with them. And I think that's really the answer for me.
Megan, your
really the answer for me.
Megan, your vaccination why story.
So much of the same things. I got my first shot. I get my second shot next week. So I'm excited for the day after that. I know I'm supposed to wait 14, but anyway, I will wait because I know not everybody in my neighborhood, not everybody in my friends has had the chance to get their shot yet. So for me, it's because I want this summer to be more like summer. I want to be able to go out and when I'm on the trails, be able to talk to people, be able to say hello, and usually not too close anyway, but it's always helpful to be able to see people and see my friends again.
And Sharon Mcdonald, your why story.
Well, I'm a physician and an epidemiologist and previously a nurse, and I'm a big booster for vaccination. I spent most of my career internationally, and what has happened here is simply a miracle in having a vaccine this quickly. I couldn't have believed that it would happen. And as a perfect public health strategy, this allows us to protect ourselves, to protect our families, and to protect our communities. And so it's a clear home run.
That's right. Science and heart all in one.
Yeah.
There you go, Sharon. That hit it out of the park right there. All right, Sharon, Megan, and Lindsay, thank you so much for joining me. Before we leave you out there, folks, today we want to remind you of one of the things that Lindsay spoke about, and that is how, if you are having difficulty getting to your vaccination appointment, how you can connect with that. The options I'm now sharing on your screen. There's Maine Care's non-emergency transportation system, again, through your local transportation provider. There's also the Motive Care vaccine transportation that's being offered as well. The hotline there, the number that you want to call for assistance with transportation is 1-855-608 5172, and you want to give at least a 48 hours notice. If you are questioning what the local service might be, your community action agency might be a good resource. They can help you connect with either this hotline or with any local service that's being offered. But we don't want not being able to access transportation to be the reason that you don't get your vaccine. And so a lot of effort and time and heart and soul has been poured into that effort here in the state of Maine. So please do reach out. If we can help you in any way, we will make sure that we connect you to the appropriate service to get you a ride to your vaccination appointment. And in some cases, there will even be the vaccine coming to you. And I don't think that we actually spoke about that. So before we leave, Lindsay, quickly on the mobile vaccination unit coming to Maine.
Yes, exactly. So it kicks off already next Monday in Oxford, and it's going to be doing a tour around the state. And the hope there is that we understand that not all of the mass vaccination sites or community vaccination clinics are really within, a good reach of folks, right? We have some pretty rural areas in Maine. And so the point of this mobile vaccination unit is to try and find communities where we can get to some of those populations in a better way. And so they'll be in towns, from Biddeford to Madawaska, and everywhere in between, I think, for anywhere from 3 to 5 days. And we're hoping that makes it easier for folks to get scheduled into those clinics. And so stay tuned for that and look for more information coming forth on where that will be and when. There is a press release up on the governor's site that has a tentative schedule of where it's expected to be. But I'm sure that we're going to continue to talk about it too, and we'll share that with our community partners, and hopefully you guys can push that out as well.
And I know we encourage Mainers to get vaccinated with whatever vaccine, but just for clarification on that one, this will be J&J one and done, right? So they won't have to look for that van that won't be there in a couple of weeks or 3 weeks when they need their second, right?
That's right. That's right.
That's
so
important.
As Dr. Shah says, the best vaccination for you is the one that's closest to your arm, but this mobile unit will be administering J&J vaccine because it is one and done, and you don't have to wait for it to do a second loop, which it's not, I don't believe, going to do.
Right. Just wanted to clarify that so we didn't leave people hanging on that one. Right. Thank you so much. Again, all three of you for joining me. That ends this week's Community Action. Thank you so much for joining us.